Welcome back to Healthy Smile Radio with your host, Dr. Randy Shoup of Dental Restorative Solutions. With inside information most dentists won't tell you about, how to be a smart, successful, and savvy dental patient, here's Dr. Randy Shoup.
We are back, and it is indeed an honor and a pleasure to have, I will preface it by saying up front, he is a good friend of mine. We are dental colleagues, and it is truly an honor to have him with us. He is a gifted periodontist. He is an expert internationally in implant dentistry. He lectures, he researches, he actually provides implant therapy, and he's one of the most gifted surgeons I have ever known. And I want to introduce Dr. Jay Beagle. Jay, it is a pleasure to be here with you.
Thank you, Randy. The pleasure is all mine. It's always a joy to be with you, and I'm looking forward to a really fun morning with you.
All right, everybody, we're going to get right into it. Dental implants, a huge growing, has been around for a long time, started early back in the 1950s with some research by a doctor by the name of Per Ingemar Brannemark, and it has matured and developed up till today. Jay, let's go right in because there's a lot of information to cover, and I want to make absolutely sure our listeners know what to expect today if they are thinking about having implant therapy done. If your dentist is saying you need an implant or you're thinking about an implant, what's the state of the art today in implant dentistry?
Well, the great thing about implant dentistry today is that it has evolved to a point where we can now predictably provide a patient with a tooth or a series of teeth that will look and mimic and function the natural tooth that they once had. Years ago, when implants were proposed to patients, we were really just restoring function for those patients, and the aesthetics weren't as beautiful as we would typically like to achieve or want to achieve for our patients. But today that has changed entirely based on a lot of the research and development that's gone on with dental implants, as well as the skills that have been developed not only by the surgeons, but also by the restorative doctors providing the restorations for the patients.
Now, when you and I work together, we have what I consider to be a really phenomenal success rate of in excess of 98% success rate on all of our implant. What are statistically the success rates and the reliability of implants now?
Well, when we look at evidence-based literature, which is what most dentists try to look at when they determine how to treat a patient, we typically see an 8 or 10-year survival rate, meaning the ability for that implant to function in the patient's mouth, of around 96 to 97% worldwide. Now, there are certainly instances where that success rate may be a little bit higher. There may be instances where that success rate may be a little bit lower. But generally speaking, implant dentistry today is phenomenal. There aren't many things as a dentist we can provide to patients that achieve the same level of outcome as we see today with dental implants.
We're speaking with Dr. Jay Beagle, an implant periodontist and implant specialist. Jay, tell us about what are the trends we're seeing in implant dentistry. Where's implant dentistry going for my listeners?
Well, if we go back in time, as we had mentioned before in this program, dental implants were very limited from the numbers of manufacturers in the world. But today we have a large number of manufacturers, and with that we have a great deal of research that's gone behind the product that we see being utilized in patients today. Today we see products that achieve a level of function in a patient's mouth in as little as 4 weeks. Now, if we go back in time, we have to remember that implants that were placed in the upper jaw or the lower jaw may require anywhere from 6 to 9 months to heal before the teeth could be placed on top of them. And to think today that we can now do this in as little as 4 weeks is absolutely phenomenal. The other thing that we see today that I think benefits patients is the fact that the crowns or the restorations that are placed on the implants are much, much more secure than they used to be. Years ago, those restorations were secured with a screw, and quite often those screws became loose and the patients had to return to the restorative doctor to have those screws tightened up. But today we found ways of securing these restorations to the point where they should be trouble-free for the patients.
When we have our patients and you and I treat them together that come through my office, we oftentimes will pretty much give them an assumption that barring anything, unforeseen illness or accident, dental implants should really function for the rest of their lives.
That's exactly true. In fact, that's what I tell my patients, is the fact that today dental implants should in fact function for the rest of their life. I think we need to have a bit of a caveat perhaps with the younger individual, the younger adult who may be 17, 18, 19 years of age, because we simply don't have enough long-term research on the life expectancy of an implant. But we have to realize today that there are implants that have been in function for as long as 45 years, and that's just a phenomenal outcome for a patient.
Absolutely. You're listening to Healthy Smile Radio, and we have the honor of having Dr. Jay Beagle with us today. Now, Jay, so many times there are a variety of providers that do implants. Oral surgeons put in implants. Periodontists like yourself put in implants. And general dentists also now have become real active at putting in implants. At Dental Restorative Solutions, what I try to do is I try to plan the case and use a team approach. Tell me what in today's world, when you and I work together, I do the restorative, you do the surgery. Tell me about where the trend is going and what should my listeners really be critical to look for if they're thinking about an implant?
Well, I think a patient really needs to seek out the help of a dentist who does work as a team with a variety of dental disciplines. That may mean that the restorative doctor, like yourself, will work with a surgeon. They may also involve an orthodontist if a person's bite or appearance is not ideal prior to the placement of a dental implant. They may have the need for root canal therapy of other adjacent teeth that might be infected, so we may work with an endodontist in the process. So there are a number of disciplines that may be required, and that's best done as a team approach. Dentistry today is very complex and very complicated and very specialized, and for a patient to get the best treatment possible, they need to seek out a team approach to their dental health.
So the old days of kind of the one-man band of where you do everything from start to finish, after having gone to maybe a weekend course or seminar, is pretty much over.
That's exactly right. And in fact, there's an organization that I think our audience would perhaps appreciate looking at on the web, is the Institute for Dental Implant Awareness. The website is idia.org. And this is an organization made up of dentists, a board of directors of sorts, that are really trying to eliminate some of the issues that we've seen in the past with doctors who are very, very quickly trained in courses that may last from 1 to 3 days on a weekend. In fact, we somewhat affectionately call these doctors weekend warriors, because quite often they receive training and they go back to their offices on Monday and begin these procedures with perhaps not being adequately trained in the selection of that particular patient for a procedure, the management of any risks that may arise, and this may be an aesthetic risk if it's a front tooth. And then obviously something very important is the recognition and treatment of complications. And all of us recognize, whether we're a dentist or a physician, that the greater number of patients that you treat, the greater probability there is to experience a complication, and it's your ability as a doctor to recognize those complications and be able to adequately treat them for the benefit of the patient.
Now, tell me, what does that IDIA website, what does that tell my listeners? If they go on that site, what are they going to learn?
Well, the patients that go on this website are going to learn some questions they would definitely want to ask either their surgeon or their restorative doctor if they're contemplating dental implants. They're also going to see the communication that's going on between the dental profession and the and the implant industry, because again, one of the problems we've seen in the past is that a lot of doctors are trained by implant companies to do procedures, in essence benefiting the implant company from a sales perspective, but perhaps not benefiting the patient from the perspective of providing the optimal care and not understanding some of the risks and complications those patients may present.